Good evening, everyone, and welcome to the Ask Dr. MJ, Your Health is Important, Facebook Live, Instagram Live, YouTube Live broadcast. This is the only interactive forum that allows you, the listener, to tune in and ask your healthcare questions. We're live in the studios here of Atlanta West Primary Care and Auburn Dental Center. We have the illustrious, the phenomenal, Atlanta's best DDS, Dr. Marlon Bradford Jackson, is joining us this evening. So we are so glad to have him here. So you, the listener, you'll be able to ask your medical questions. You'll be able to ask your dental questions. You will be able to get healthcare information, again, unparalleled in the history of medicine. Why? Because the Medical A Team is here for you today. We are live in the studios and we're going to talk about what you'd like to talk about. But I'm going to pick back up what I talked about this morning on the Rickey Smiley Morning Show on Wellness Wednesday because it was a great and interesting topic. One, the topic is medical marijuana. Medical cannabis is now legal in 38 states, 3 U.S. territories, and the consumption is exploding. The first time is highest in patients who have no previous use of marijuana, no history of use. So that means these are not college students or people who used it back in college or people who used it back in the day, as they say. These are people whose first experience with marijuana is happening now. And we're starting at age 50, but we're looking at individuals in their 70s and their 80s. This is absolutely incredible. Now, why are senior citizens using this? The most common use is for pain, insomnia, and anxiety. So the favorites are edibles. America's preferred form of medical marijuana has shifted from smoking to munching those little gummies. 16 million Americans over age 50 have admitted to using cannabis. That's up from 12 million in 2021. And that's, again, the people that admit to doing it. Research now shows that the use of edibles exceeds that of smokers for the very first time. So that is where we are with that. Lots of retirement communities are starting not pickleball clubs, but cannabis clubs. And sales of cannabis have topped $27 billion. That's billion with a B. So 28 years after California became the first state to legalize use, evidence indicates that cannabis now helps with chronic pain and actually decreases the use of narcotic pain medications. For individuals that are challenged by using higher doses of things like hydrocodone and Percocets, they are using less of them or not using them at all based on cannabis use. Now, this is the thing. The cannabis works very well for chronic pain, does not work as good in acute pain situation. So this is not what you want to do for a sprained ankle or pulled back, low back pain, or an acute dental or surgical pain. It's not going to give you the type of relief that you would get for chronic pain. So this is what we refer to as neuropathic pain and other types of chronic pain versus acute post-injury pain. So, and let's get to the myth right now. Medical marijuana has not been shown to help with glaucoma. Scientifically, it's anecdotal, and then or high blood pressure for that matter. But some people, when they do imbibe in marijuana or take, they're under influence of THC, their stress levels are decreased, their anxiety levels are decreased, and they do quite well, and their blood pressure comes down. So there you have it, listeners. That's where we are today with this. And I want to give a special shout out to my brothers from Morehouse College. We had our reunion year. This was my reunion year this year, and all last weekend, mostly last week, not just the weekend. I was at or on the campus. And as you know, we had the President of the United States, Joe Biden, came as the keynote speaker for the graduation. There was a lot of concern because there were protests and people complaining about him attending because of his support for Israel. Well, when on the campus, I was approached by a Secret Service man. He asked me, "What do you think is going to happen at the graduation?" And I said, well, these young men are men of Morehouse. And upon graduation, they'll be Morehouse men. And I said, we expect them to conduct themselves with the appropriate decorum. And they did not disappoint. Those young men were eloquent. They did make their silent protest, but they also gave the President of the United States the respect that he was due. There was no shouting. There was no, no bad words. Not what you see when you watch Congress these days. I was very, very proud of my Morehouse brothers, and I could not be more pleased with them. I want to thank the Morehouse community for showing me and demonstrating to me what Black male excellence is and continues to be. That is, again, the best 4 years of my life, Morehouse College, and I was so glad to participate in all the activities this weekend. Shout out to my Spelman sisters as well, because we celebrate together. We call it Spell House. And so we had the graduates from Morehouse and Spelman celebrating their reunion together. It was a phenomenal event. So let's get to it, Heidi. Let's do a roll call and see who we got right now tuned in. Winnie King. Hi, Winnie. Thank you so much for tuning in. We hope you have medical questions and dental questions for Atlanta's best DDS, Dr. Marlon B. Jackson. Sherry Gamble. Hello from Dallas, Texas. Dallas is in the house. Hi, Sherry. Okay, Glenda Everett. Hi, Glenda. Good evening. So good to hear from you. And she's saying hello to both of us, Dr. Jackson. Very good. Okay, Antoinette Gross. Hello from Boston. Now, Boston, we didn't have Boston on last time, but Boston, we got a large following there. Thank you, Antoinette, for tuning in tonight. Carolyn Brown from Michigan. Okay, now we're the Midwest. We got the Midwest covered. What about New York, New Jersey, Florida? Mimi Witcher. Okay, Tampa, Florida in the house. Hey, Mimi, how are you? So good to see you. Sean Big Time Green, my man from Monroe, Louisiana. Sean, I'm still waiting on you to send me some Tupperware full of seafood, man. I need some good Louisiana food. Miss Makiba Boland, good evening. So great to hear from you as well. Jazzy Jeff from Dallas. Jazzy, so glad to hear from you. Love all my male listeners, and we really appreciate you tuning in. David Brown from Baltimore City. All right. Baltimore Orioles in the house. Okay, Sierra Witcher. Hey, Sierra, how are you? Thank you for joining us as well, and good evening to you. Okay, Mr. KBG70 from ATL. All right, Mr. KBG. We're glad that you are here, my friend. All right, Makiba. She's saying hello to you too, Dr. Jackson. Can you see that screen, sir? All right, Dr. Jackson, you with us? Okay, very good. Let's get to your medical questions right now.
Tell Makiba I said hello.
Okay, very good. So, Dr. Jackson, how have you been since the last time we saw you and you participated in the program? So glad to have you back.
Yes, I'm with you. Hold on a minute.
Okay, very good. We're glad to hear that. Okay, Holly, let's go to the questions then. Okay, Vanessa Burks from Houston. Thank you for tuning in. Tilly Shocks. Hey, Tilly from St. Louis, Missouri. Now we're going to, she's an AKA.
Thank you, Dr. Collier. It
go ahead, Mark.
That we have a little delay.
Okay, well, how have you been since the last time we saw you? Okay, we got a long delay. Okay, very good. Marlon, tune in as you hear the questions, and we'll start talking to our listeners right now. Okay, go ahead. I'm from St. Louis, and I gifted a friend a bottle of lipo drops.
I'm doing fine. I enjoyed being on your show, and you have some very intelligent listeners.
Okay, thank you. All right, Lynn. Lynn, let me tell you, the lipo drops bottle. We want to make sure that the individual is using them correctly, because they should see results within the first week and definitely by the end of the first bottle. You put 1 dropper full under your tongue before you eat. You hold it under your tongue for 2 minutes, and then you swallow it. The mechanism of action occurs under the tongue. It does nothing inside the stomach. So it's very important. I have people that squirt it in their mouth and swallow it immediately. So it is very important that they take the lipo drops, hold them under the tongue for 2 minutes. That is where it is absorbed. That is where it works. That, and once absorbed, it alters your body's metabolism so that you metabolize fat very effectively and very efficiently. So they should see some results almost immediately, particularly if they follow one of the diet plans, either the 5 meal per day or the intermittent fasting that should have come in the box with it. If not, they can go to the website, lipodrops.com, and get more information about the diet and how to do it. Okay. Wayne Dunston, my PSA number is 7.1. Can you talk about the numbers and what to get next? Well, Wayne, a number of 7.1 is elevated. A normal PSA should be 4 or less than 4, ideally. 2 things: when it's greater than 4, it's too high, or even if it's less than 4, let's say it's 2, but it goes up to 4 in less than 1 year. If the number increases by more than 1 point in a 12-month period, then that's a red flag. And a number greater than 7.1 is a red flag as well. However, when the number is less than 10, the vast majority of the time it is associated with an enlarged prostate hypertrophy, or benign prostatic hypertrophy, or BPH, which every man suffers from. And, starting about age 40, and definitely every decade of life, your prostate gets bigger, and a larger prostate produces more PSA. So what I normally do under this circumstance is I'll treat a patient for prostatitis, which is inflammation of the prostate. I give them a course of antibiotics along with an anti-inflammatory, place them on my vitamin D and my omega-3 fish oil products, then recheck that PSA, and I give them 2 weeks to treat, 2 weeks to heal, and then recheck. If the number goes down, then we can recheck the number in 6 months. If the number doesn't significantly decrease or increases, then we need to have further evaluation, and I will make a referral to a urologist who will do, now they actually have a new technology. You can have an MRI of the prostate, which can look for lumps, bumps, and masses much more efficiently than a digital rectal exam, but the digital rectal exam is a part of the process always. And then, depending upon what the results of that are, you may get a prostate biopsy. That is the only answer to the question. Anything else is just a guess, or could be and possibly and clinically significant. But what you want to know, if you want to know the answer to the question, you have to have a prostate biopsy. And the answer to the question is yes, it's prostate cancer. No, it's not prostate cancer. But again, the vast majority of the time, when the PSA is less than 10, it's not prostate cancer. Doesn't mean it can't be. So that's where we are with that workup. See if you can get your primary care doctor to give you that course of therapy, or the urologist for that matter, the antibiotic, the anti-inflammatory, then recheck your PSA and see if you respond to that therapy. Wayne, let us know how you do with this. We want to stay updated on it. Great question. Hi, Makiba. I've been diagnosed with intracranial hypertension. What can I do for the headaches that result from this? Ms. Boland, we are so glad that you have tuned in. Intracranial hypertension basically is increased blood pressure inside the skull and inside the brain. So it's no way to target that area specifically. The best thing to do is to control your blood pressure totally. If the pressure is too great, sometimes you have to decompress the brain by surgically implanting a shunt that drains the cerebral spinal fluid from the inside the brain to below. Basically, it just dumps it inside your thorax, or it can even recycle it back into your blood flow, and so that you don't have excess levels of cerebral spinal fluid, or CSF, and inside, which creates a greater pressure. So this can be treated, and there are also some other medications that you can take that can help decrease it that are not blood pressure specific, but there are things that are utilized to help with this. So you have to partner with your primary care as well as your neurologist to get the best outcome that you can for this disease state. Great question, Ms. Bolden. Thank you so much for asking. Christina Ray, what are the benefits of cosmetic dentistry procedures? Dr. Jackson, can you see that question? Answer it. Can you see that question? If you can, address it. Okay, I'm not sure whether he can see the question or not, but that asks about the benefits of cosmetic procedures. Cosmetic procedures are just that. Cosmetic means this to make you look better. So tooth whitening doesn't give you any benefits dental health wise, but
okay, that appears viewers there's delay. How anyway, there's plenty of benefits from cosmetic dentistry procedures. Well, the benefits of cosmetic dentistry are these. First of all, you increase
looks like he's freezing up there. So yeah, the benefits are many, particularly emotionally and socially, because when you have $1 million smile, you conduct yourself in a totally different way than when you have dental challenges. You have missing teeth, broken teeth, rotten teeth. Then you will subdue your smile intentionally because you don't want to show those teeth off. So you speak with your mouth half closed. You don't approach people as closely. So there are great benefits from that. But unfortunately, when a procedure is labeled cosmetic, that usually means your insurance is not going to pay for it or cover it. So cosmetic can be as simple as teeth whitening. Then you can get bonding, which can fill in dental gaps, and then full orthodontia, which can straighten out crooked teeth, and then dental implants that can replace missing teeth. So all of those are available for you. Dr. Jackson is the harbinger of the $1 Million Hollywood Smile. So if you want to get further consultation with him, you can reach him on all social media at Dr. Marlon B. Jackson, and then just Google Dr. Jackson at Auburn Dentistry, and he can get back to you on that. Okay, now put that other question up, Hailey. Okay, a male friend died sitting on the toilet yesterday. As a nurse, I thought it might be due to the Valsalva maneuver. I think the community needs to know about this. Can you discuss this? Absolutely. B, thank you so much. As a nurse, I'm so glad you're bringing this to the attention of our listeners. The Valsalva maneuver is when you increase the pressure in your abdominal area by holding your breath and pushing down and going, When that happens, there's pressure that's put on your aorta that increases your blood pressure and makes blood rush to your brain. So it can do two things. It can make you have a stroke. It can make you have a heart attack. The most famous case is Elvis Presley, who was chronically and continuously constipated because of his use of narcotics, which a side effect of is chronic constipation. So when you have to strain to have a bowel movement, you increase your pressure. You can feel it when you do it. When you have a bowel movement, you can feel your face filling up. You can feel the pressure inside your head. And that is what can happen. So you need to avoid that, particularly when you're a more seasoned person. But you can be young and this can happen to you as well. But as you age, you want to make sure that you're not straining to have a bowel movement or any other times that you're increasing your abdominal pressure. You can be doing crunches and you can do that. And it's the same thing as doing the Valsalva because you increase that abdominal pressure. And that is why when you exercise, they say, do not tighten up the stomach like that because you compromise blood flow. And when you feel that happening, again, the things that can happen, it can compromise blood flow to the heart. So unlike other areas, the heart only has two arteries. One artery, the left side, covers 2/3 of the heart, and one artery, the right coronary artery, covers 1/3 of the heart. You get obstruction of blood flow on the right side, that's a minor heart attack, and you usually can survive that, although your heart and blood flow is compromised. But if you have a compromise on the left side where you're cutting off 2/3 of the heart, that's a massive heart attack, and usually you're not going to survive that. And so that is why when you do that, blood flow to the heart is compromised because it's going other places. So it's a cardiac steal. You steal the blood flow from the heart to go to other places, and then you push and increase the amount of blood flow that's going to the brain. So that is a big problem when you're doing that. So you need to be careful and conscientious about how hard you strain. Another side effect of that is hemorrhoids. Hemorrhoids are nothing but dilated veins. And when you do a Valsalva maneuver, you reverse the flow of those veins. If you look at the veins on your arms and your legs and you see those little bumps, those bumps are valves. The purpose of those valves is to have blood flowing only in one direction, and that's back towards your heart. But the anal veins are the only place in your body where the veins have no valve. So the flow, when you put that extra pressure on there, you reverse the flow of that blood in those hemorrhoidal veins. The blood is coming in, the blood is going backwards. So what does that do? That dilates the vein, and eventually it stretches, and it can blow out. And that is what a hemorrhoid is. You get a big dilated vein. So that's a minor complication unless the hemorrhoid gets a clot in it. If the hemorrhoid gets a clot in it, it is excruciatingly painful. You cannot sit down. You cannot think. You cannot do anything to get relief. You have to surgically have it excised. So great question, B. Thank you so much for tuning in. And as our medical ready reference, we want you to give us some more nursing insights on future broadcasts. Okay, Irvin Lofton, 68-year-old man, has an enlarged prostate. My doctor recommended surgery called a hormone laser elucidation. Is that a good way to go, or in your best opinion? That is a wonderful way to go, Irvin. I'm looking forward to having that procedure at some point in my life as well. This is the green laser procedure that literally goes in. It carves out a fresh tunnel and excess prostatic tissue, it seals it and cauterizes it instantly, so the recovery time is minimal, and the potential for post-op complications like incontinence, inability to hold your urine, and or the ability to get erection are less with this procedure. So because they basically go in and core out the prostate enough to decompress it so that you can have good urine flow. So this is a good option. There are others. There's a new procedure called aquablation. Aquablation. They do the same thing, but instead of using a laser, they use a high pressure stream of water. It's kind of like a water pick, that dental apparatus that we all used to be familiar with. I'm sure you are since you're 68 years old. They basically use that as a carving tool as well, and they carve out prostate tissue. Now, the thing and the problem with that is it doesn't cauterize and stop bleeding like the laser does. The laser seals and cauterizes basically instantly. So the recovery time is much less, the bleeding is much less, and it's almost healed almost instantly because of that technology. So the old school technology is literally just take a surgical instrument that's like a gouge, and they would go in really, and they would carve out pieces of your prostate. They call them prostate chips, and that was the outcome of that, and the amount of trauma was directly proportional to the skill of the surgeon that was doing it. So if he was big-handed and heavy-handed, would go in there and just dig all around, you'd be sore, incontinent, and probably not able to get an erection because it would destroy the nerves that are along the prostate that control that. But then there were other doctors that have millimeter to millimeter control and could do that. But that is, no doctor should be doing that at this point because the technology has improved so substantively and significantly. So the laser enucleation is a great technology and a great option for that procedure. But they even have a procedure where they can put nylon strings in there and tie and pull the prostate back to open it up as well. That's also an option. So Google treatments of BPH or benign prostatic hypertrophy and get some of the other insights. But of the options that are available, this is one that I highly recommend and endorse. It is probably the way I'm going to go once I get to that point in life. Okay, great question, Irving. Christy Jamison, I recently was diagnosed with hyperthyroidism. Any recommendations? Yes, the treatment that hyperthyroidism is too much thyroid. When you have too much thyroid, it increases your metabolism to dangerous levels. It can make your heart race. You have tachycardia or heart rate greater than 120. It can increase your blood pressure, and it can be dangerous by causing what's called a thyroid storm. And that is when your blood pressure gets so high, it can make you have a heart attack or a stroke. Now, this is treated in a variety of ways. The most common is to chemically treat it with a pharmaceutical product that lowers your thyroid levels chemically. It stops the production of thyroid at the thyroid level. And the thing is, it's called PTU or propylthiouracil. And you treat to the dose that is effective, which lowers it for you. It has some side effects. Those side effects, it can make you jittery, but so can the hyperthyroidism. It can give you hot flashes. It can give you a lot of things. One of the other things to do is to basically kill the thyroid. You give radioactive iodine, and that totally eradicates the thyroid function. That is injected intravenously. It goes to your circulation. It gets to the thyroid. Your thyroid absorbs it, radioactive iodine. And when it is absorbed, it stops the thyroid from working. Now, the complication of that is now you are euthyroid and you have no thyroid function, which means you are required to take thyroid supplementation for the remainder of your life. But that is a viable option and a better option than dying from hyperthyroidism. Now, the other options that they have are partial thyroidectomy. Your thyroid gland sits here, right over your trachea, and it's shaped like a butterfly. So if the butterfly's body is here, the wings come here on both sides. So they don't come that far. I can't get my hand right. Okay, good. Yeah, come about a few inches, about right here. That's where it is. And I can imagine a butterfly shape here, wings here and here, and the body right here in the center. Well, they can take off a portion of that. They can take off a half of one side. They can take off a half and cut it right down the middle. And then hopefully what's remaining will give you adequate thyroid hormone levels without giving you excess thyroid hormone levels. So all of those are options that are to be considered, but I would start off with the least complicated one, which is taking the medication. Sometimes a person will spontaneously resolve hyperthyroidism because it's due to an autoimmune thing called Hashimoto's thyroiditis, where antibodies are created by your own body that attack the thyroid. And that can be a temporary situation, so it can calm down. So if you control the thyroid levels while that's happening, and then it goes away spontaneously or just over time, then you might not ever need to have any other additional therapy. One other thing that you normally are treated with is beta blocker class drugs because they control your heart rate and control the increasing metabolic rate that is associated with hyperthyroidism. So beta blocker class drugs, the classic ones are metoprolol, but there are newer ones. But most doctors default back to metoprolol. I think it's basically just because of familiarity. There are new beta blockers called diastolic and carvedilol that I think work better with fewer side effects. But most doctors will default back to metoprolol, particularly endocrinologists. And so that is one of the things in addition to the propylthiouracil uracil that you would take. Okay, great question, Christy. Okay, Vanessa Burks. What's severe abdominal pain that occurs every 2 months or less, lasting up to 7 days and having to get pain medication in the hospital? Beforehand, nauseated almost daily, almost always has something to chew on. Okay, this is a GI upset. It could be irritable bowel syndrome. It could be a lot of things, but what you're going to have is an upper endoscopy where they go down your throat and look through your stomach and the first part of your small intestines, and a colonoscopy where they check out your colon to make sure that you're not. Every 7 days sounds like it could be chronic constipation that needs to be treated. In the good old days, if you went to the hospital with this kind of problem, they would give you an enema. They call it with hot water or soap suds enema. Hot, hot and hell of a lot is what they would say. It was 3 H's. I can't remember what the third one is. But hot, it doesn't have to be hot, really. It's just warm and a hell of a lot. They basically ran water through that colon until it was clear and clean. Now you just can't get that in the hospital. They'll do a CT scan on you, tell you you're constipated, and send you home with instructions on taking a laxative, which doesn't fix the problem. If it can fix the problem, it might not do it for days, and in the meantime, you're in excruciating pain. Whereas if you just were given an enema, the problem could be fixed in 5 minutes. So this is, again, where we are in the state of medicine. They don't like to do anything treatment-wise in the emergency room. You go to the emergency room, they just determine that you're not dying, whether you are dying or you're not dying. Now, if you're dying, they will save you. A heart attack, stroke, surgical, a problem requiring immediate treatment. But if it's anything else, they just say, oh, well, it's not this, it's not that. They tell you that is what it's not, and then follow up with somebody who can actually do the work and take care of you. And so this is where we are with that. So you need to have a good relationship with your gastroenterologist. You need to have at least those 2 tests performed. You might end up getting a CT scan and or an MRI of the abdomen, an ultrasound of the abdomen as well. These are all looking for mass lesions that can cause this problem. You can have problems with strictures inside your intestines that are causing it to back up. You could have mass on the outside that are pressing on you. So imagine that your intestines are like a tube, like a water hose. And if something matches on it, you ever folded a water hose over or squeezed it to make the water squirt hard? Those sorts of things can happen inside your abdomen, and various types of tests can determine whether that is indeed the case. So it's going to require full workup. Right now, you're just getting your symptoms treated. Nobody has made a diagnosis, and nobody has tried to fix the problem. So they're just, treating you acutely because you go in with severe pain. They give you something for the pain, then send you out. So you're going to have to get some follow-up therapy, preferably by a gastroenterologist, a stomach specialist, to evaluate what's going on with you, Vanessa. Okay, great question. Zandra Johnson, good evening. I heard a little about what you said back in October 2023. Daily sinus issues, earache, worse on weather conditions. You say a minor surgery will fix my sinus issue and severe sleep apnea. Please advise in more detail. Yes, Zandra, there are surgical techniques now. They can stick a camera scope inside your sinus, is called an endoscope, and they can have a little balloon on it, and they can dilate and open up your sinus passages. Whereas before, they would literally have to go in with a hammer and a chisel and chop, and create a new hole. So that is one of the things that can, because you got 2 issues there. You have metabolic issues like allergies, which causes tissues to swell. And then you got a plumbing problem. Once the tissues are swollen, then you get backed up of flow of mucus. And when the mucus is flowing, the mucus is sterile. It's a great environment. It carries dust, dirt, and all kind of bacteria and viruses down out of your sinuses into your stomach acid digest it, and you're never aware of any of this going on. This is basic metabolism of the sinus system. Well, if you get obstruction, that mucus sits there. That mucus is a perfect environment for bacteria to grow in. It's a nice sterile fluid. It's at 98.6 degrees in most people, so it's a perfectly warm environment. And back when mucus doesn't flow, bacteria will grow. When mucus doesn't flow, bacteria will grow. So if you get that bacterial growth now, what should be thin and watery and clear now becomes thick and yellow, green, or brown. Different colors indicate different types of bacteria. Staphylococcus will be one color. Streptococcal will be another color. Streptococcal infection is usually rust colored or brown. So that indicates what's going on there. And then for the sleep apnea, the back of your throat, where the little thing that hangs down called the uvula is there. That little dangly thing in the back of your throat. Well, most of the time in the back of your throat, it should be open like this. So you should have a wide space like that. Well, when you have sleep apnea, most of the time that space is compromised. So instead of it being like that, it's like, instead of like that, it's like that. So much smaller air transportation is happening in that area. So what happens then is that the airflow is compromised and you got that loose tissue. That loose tissue gives you what's called a tent flapping phenomenon. So you don't just snore, but you go very loud, very disturbing to any of your sleep partners. So they can take a laser or just a scalpel and they cut out that excess tissue. So that little hole becomes a big hole. So instead of going, now you're going, you're moving much more air and much more air on a cellular level. Number one side effect of that corrective surgery is weight loss. Most people drop 20 or 30 pounds easily because they're getting more oxygen to their body on a cellular level, and that burns fat as fuel. So you just melt, and you don't have to do a single sit-up, crunch, alter your diet, none of that stuff. Just getting more air in there, you have that benefit. So we greatly appreciate that as surgical options. You need to talk to an ENT doctor, ear, nose, and throat specialist. If you are in or around the Atlanta area, we have a phenomenal Dr. Terry Seymour. Dr. Terry Seymour, one, is African American. Two, he's trained. He's an ear, nose, and throat specialist. He's a plastic surgeon, and he is a sleep certified specialist as well. So that's three doctors in one. He's one of these overeducated brothers that's too smart. He's just very, very articulate and intelligent, but he's the perfect person to deal with this problem for you. He's worth coming to town for if you don't have a comparable individual where you live, and I promise you, you don't, because I don't know any other doctor that has three specialties like that, and he does. And he's certified in each one of them. So Dr. Terry, Terry Seymour, Seymour, you can Google him. Ear, nose, and throat. Facial Plastics is the name of his business, his practice, medical practice, and he can give you more insight into those options. Thank you, Zandra. Great question. Antoinette Gross, what do you recommend for blood pressure? Do the diet drops work on teenagers? Thank you in advance. Yes, they do. Basically, older kids can take them. There's no restriction on age really, but I'd say older kids, adolescents, teens are great. Same thing, a dropper full under the tongue before eating, and it will help change and alter the metabolism. I also need to do either the 5 meal per day plan, which is breakfast, lunch, and dinner, and a snack in between breakfast and lunch, and a snack in between lunch and dinner. And what that does is that basically keeps you from being hungry. You're full, and your body recognizes that you have fresh fuel or food in your body, so it doesn't have to make you crave anything. It doesn't have to make you want anything, but more importantly, it doesn't have to store any food as fuel. So once your body realizes, hey, I don't have to store any food as fuel, after a couple of weeks, it says, hey, Antoinette is serious. Not only do I not need to store food as fuel, I can let go of some of the fuel that I already have stored, and just because I have fresh fuel coming in every 3 to 4 hours, which is what the 5 meal per day plan does. So what that does is that all of a sudden that mechanism cuts on. It takes about 2 weeks, and you literally just start to melt. And you know, it's incredible how effective that is. And it is a long-term weight loss solution because it alters your body's basal body metabolism, not just restricting calories. Restricting calorie diets, that's your strip mall diets, that's your Jenny Craig's, your quick weight loss, your Weight Watchers. Each and every one of those diets works by monitoring and restricting your calorie intake. Guess what? They all work. If you do what they tell you to do, exactly the way they tell you to do it, you will lose weight 100% of the time. You will lose weight. The problem is that once you resort back to bad habits, you gain the weight back. The average typical weight loss on those plans is 20 to 30 pounds. The typical weight gain post plan is 30 to 40. So you gain back usually at least what you lost, sometimes more. But more importantly, when you gain the weight back, it's all fat. When you lose the weight, you lose a combination of muscle and fat. And so you start off at 250 pounds, you lose down to 200, you gain it back. You can't get in the same clothes you had when you were 250 pounds before, because now your body has changed. You have a greater fat percentage, you have less muscle, and you're more doughy. So your body shape changes, your somatotype changes, and you look less healthy. You are less healthy because you've increased your susceptibility to things like diabetes, high blood pressure, high cholesterol. But you're just more doughy now. With increased body fat, particularly when it's in the abdominal area, you're at higher risk for a heart attack or a stroke. So we want to make sure that when you change your metabolism versus restricting your calories, you lose almost all fat. Worst case scenario, you gain it back, you're no worse off than you were. But the objective is to keep your metabolism changed and metabolizing food in a more effective and more efficient manner so that you don't gain the weight back. And that is what the whole basis of the weight loss program is that we have on the LipoDrops website. So go to the website, lipodrops.com, find out how to lose weight, which benefits virtually every disease state that you have. Diabetes, high blood pressure, boosts your immune system, decreases inflammation, helps with joint pain, all of the things that we talk about. I had a question this morning about menopause as well versus menopause. Menopause ladies, menopause for men. And what can you do about it? We have two great products for that. For the ladies, we got the Lipo Hers. This product relieves hot flashes. It changes your basal body response to lack of hormone by giving you back, makes your body and stimulates your body to make hormones in a natural manner. It increases your libido. It increases your feeling of goodwill, things you can't necessarily describe, but it makes you wonderful. Go to the website and look at some of the benefits of the Lipo Hers. And for men, the Lipo T, we all know what the Lipo T does for you. It enhances your libido. It improves the quality of your erections, making your erections longer and harder. It makes your sex drive go through the roof, and you're also able to step up and do those things. So go to the website, get more information on all the Lipo line products that are there, and we will go to the next question. Hailey? YouTube user, my name is Margaret. I suffer from colitis and inflammation. Is there anything I can do to help with the inflammation? Yes, Margaret. One, there's such great breakthroughs in the treatment of colitis and inflammation of the colon that have happened now. This is an autoimmune disease state. So colitis, ileitis, Crohn's disease, all of them are autoimmune diseases, and they can be treated with some of these new biologics. The first use of these medications, one of the name brands is Enbrel, Embrel, but there are several out there now. There are commercials on every 5 minutes about them. But the original Enbrel was for arthritis pain, rheumatoid arthritis in particular. And what they found out was rheumatoid arthritis is an autoimmune disease, and a lot of people that had rheumatoid arthritis also had colitis and other inflammatory conditions. So they would start taking the Enbrel, and not only would the arthritis resolve and be well controlled, not necessarily cured, but all symptomatology under control, but so with the GI symptoms. No more colitis, no more alternating diarrhea and constipation, no more abdominal pain causing you to double over. And so they start redirecting the medication to specifically for Crohn's disease, colitis, and ileitis. Now, but when you have inflammation, inflammation is from head to toe. It's all over and affecting everybody's system. So how do you treat the inflammation naturally? With natural anti-inflammatories. The most common and the one I recommend most is vitamin D, but you have to take it at a therapeutic dose. The therapeutic dose is 5,000 international units per day. 5,000 international units per day, which is what our doctor's decaplet. Our doctor's decaplet has in it. One of those a day decreases inflammation. There's a test that you can monitor called the erythrocyte sedimentation rate, or SED rate. It is a test for inflammation. It's a blood test, and it should be between 0 and 30. So if it's even on the high side of normal, you have inflammation. But if it's higher than 30, I just had a patient who was 55. They were 55 today. So we put them on the vitamin D. Vitamin D levels go up. A normal vitamin D level is 30 to 90. We got the vitamin D level up to 70. And guess what? The erythrocyte sedimentation rate or SED rate drops. So the inflammation is decreased. Other things you can do, omega-3 fish oil is very good, particularly for cardiovascular inflammation. And then there are other natural anti-inflammatories like curcumin, which comes in powder, comes in capsules, comes in tablets, comes in teas. So many different things and ways you can get curcumin or turmeric, T-U-M-E-R-I-C, at health food stores. But now you don't even have to go there. It's at every grocery store, every pharmacy. They have a whole line of what we call natural medicines and natural supplements that can help with that. So those are the things you can do, Margaret. Decrease your stress level. Things like CBD oil would be very good for this as well. But you have to take a therapeutic dose. 300 milligrams is not going to do you any good, but 1,200 milligrams of good CBD oil will be excellent for this and will help in so many different ways. The cannabinoid system has so many receptors throughout the body that we are just discovering all of the benefits from. And this is CBD. This is not THC. This is not gummies. This does not make you high or happy, but it stimulates the cannabinoid receptors with the CBD oil, and you will get all the benefits without the THC. Okay, great question. Mickey B, what's the best cure for BV? BV, bacterial vaginosis. One is a bacterial infection, and it's going to have to be treated with an antibiotic. The most common is that you can use clindamycin for bacterial vaginosis. You can use Flagyl or metronidazole for bacterial vaginosis. You can even use some other types of antibiotics. Those are the two best for it. The problem with BV is getting reinfected. And so if you are treated, you take as a one-day treatment with metronidazole, you take 4 pills one time, and then you still have to abstain for a week, but you don't have to take any additional medication. That will eradicate the bacteria that causes the bacterial vaginosis. But you have sex with your partner, your husband, your boyfriend, a week later, and he give it right back to you because they were not treated. This is not necessarily a sexually transmitted disease. This is not gonorrhea. This is not syphilis. This is not chlamydia, but it can be transmitted sexually. So if a man has the same bacteria within his urethra, or if he's not circumcised under his foreskin, then he's going to have to be treated as well. You both be treated at the same time. You both abstain for the same period of time, which would be 7 to 14 days. And then you should be able to resume intercourse with no problems and no recurrence of this infection. The same thing happens with yeast infections as well. And there's a long list of bacterial infections that are not sexually transmitted diseases, but that list, there's new technology. You can take a urine specimen and do what's called urine genetic pathogen testing. You just give them the same urine. They can test for 50 different things. And it is amazing how effective this test is, because not only do they tell you what it is, they tell you what kills it, what you should be treated with, and make recommendations as far as your therapy is concerned. This is really phenomenal for men. Let's say you have a partner that's been diagnosed with trichomonas. You do that with women. They get a pap smear. It's diagnosed. They see the trichomonas, so you can even look under a microscope with a specimen, a vaginal smear, and you can see the trichomonas. They swim, and it's easy enough to make the diagnosis. And you can also do it you put something special on the vaginal secretions, and it gives you a strong amine odor, a very strong fishy odor, and that's diagnostic of bacterial vaginosis as well. But guess what? There's no test for men. Has not been a test for men. Men were only treated for trichomonas when their partner told them, I have it, the doctor says you need to be treated, or the doctor sent a prescription home for the male partner to take. But nowadays, with genetic pathogen testing, You can add sexually transmitted diseases with sexually transmitted diseases, which will test you for herpes, trichomonas, test you for chlamydia, gonorrhea, all those things. From that one urine specimen, it is absolutely incredible technology. 99% of doctors' offices can do that now. Some of them just don't do it because they're not familiar with the technology, so they don't order it, and they just test for the usual and customary. They take a swab and check you for chlamydia and gonorrhea. If it's not that, then they say, oh, you don't have anything, or you tested negative. And so the technology is there now where a better diagnosis opportunity exists. But your answer to your question, bacterial vaginosis, metronidazole or clindamycin, then I would add probiotics so you can replace that bad bacteria in your vagina with good bacteria, which won't have any problems or give you any potential side effects. So our probiotic product, 2 capsules once a day, will help improve vaginal health, give you great vaginal health, and improve your GI health as well. So your breath is fresh and sweet. Your bowel movements are still foul, but not quite as foul as they were. You don't mind if somebody goes in the bathroom after you come out, because it smells like somebody was in there, but it doesn't smell like it's like, whoo, close that door. Somebody blew up the bathroom. You don't have to worry about that. So great question, Mickey B. We appreciate you. Jewel, are any of the vitamins you provide good for eliminating or minimizing fibroids? No. Fibroid elimination requires hormonal therapy and medications that alter your menstrual cycle, particularly progesterone pills or progesterone combination tablets that contain progesterone, will cause fibroids to shrink. That is what happens when a woman gets pregnant. If the fibroid is not so large that it prevents pregnancy, a woman gets pregnant and the fibroids shrink, and sometimes they shrink to a point where after delivery they do not come back. Other thing is hanging in there with the fibroids until you go through menopause. You have the same thing. There's no longer estrogen supporting the fibroid growth, and so the fibroids will spontaneously shrink. But if the fibroids are already too big and causing problems by compromising the expansion of your bladder, so instead of your bladder being able to swell up and hold this much urine, it's got a big fibroid that's mashing it, and so now it can only hold this much urine, or it can push backwards. It can go to the backside and press against your colon. So now, and you're trying to pass stool and you got something mashing on the outside of the colon that's preventing that from happening, so you get chronically constipated. And so also it can cause pain and discomfort when you have intercourse. If the fibroid is infected or infiltrating the lining of the uterus, you get heavy bleeding, abnormal bleeding, and again, painful intercourse. So fibroids are, there's no natural way of eliminating them, so to speak. It has to be treated aggressively. And some of those, they'll tell women to stop drinking coffee and all these things that my personal medical opinion is has minimal benefit for fibroids. Once they are there, they need to be addressed, and the sooner the better. They can be, tiny little things like this. They can be this big. They can be the size of a basketball. So if you let it get that big, the only option is really surgical. And if the fibroid is pedunculated, which means it's like a mushroom, it's got a big body and a tiny base, they can just clip the base and remove it. That's minimally invasive surgery. They can do that through your belly button and no problem. If it's kind of halfway in and halfway out of your uterine lining or the musculature of the uterus, they can scoop it out sometimes, leaving the muscular wall intact, leaving your ability to get pregnant intact, and remove it with minimal complications. If it's within the lining of the uterus, then they have to cut it out, and that will compromise. They take a wedge-shaped resection of the uterus, then they bring those two edges back together. But now your uterus, instead of being this big, is now this big, so it's smaller and it has less ability. It will grow. If you got enough of the lining in there to conceive and get pregnant, it will grow. It will grow back out, so no problem. This surgery happens all the time. But if you have multiple fibroids and they got to take out so much uterine tissue that it's not enough uterus left to support a viable pregnancy, or if you've had all your children and you decide, I'm not going to have any more children, then you don't need your uterus. You can take the uterus out, and that fixes the problem. So there is a minimally invasive technique now called uterine fibroid embolization, UFE. You can look that up. That is absolutely incredible. It's not an option for everybody, but it's an option for a lot of people. It's not necessarily related to the size of the fibroid, but the location of the fibroid and the number of fibroids. But what they do, they basically thread a catheter through the artery going to the uterus, the uterine artery. They squirt some pearls or some pellets in there, and block the blood flow, that blocks the blood flow to the fibroid shrinks and melts and just goes away. And so that is an amazing technology, and that is not performed by a GYN. So most GYNs don't offer it as a treatment option. They offer only traditional surgery or hormonal manipulation until it becomes a surgical problem. This technology is, and the surgical procedures available by an interventional radiologist. In Atlanta, we have Dr. John Lipman, Lipman. He is absolutely incredible. One of the early pioneers of this procedure, has done thousands of these procedures and has great outcomes. So look up Dr. John, John Lipman, Lipman. If you call him, tell him I referred you. He'll treat you like the queen that you are. And you can find out more information about all of your options for treating or minimizing the fibroids, including uterine fibroid embolization. Jewel, you might get the award for the question of the day. Okay, Bonnie Woods, can Wegovy make your hair thin or fall out? Bonnie, not Wegovy per se. It's not a side effect of that, but it is a side effect of weight loss because your metabolism is changing. Your hair is one of the highest, has one of the highest metabolism of anything on your body. That is why when cancer patients get chemotherapy, the chemotherapy is absorbed by the higher metabolic tissues. That's your cancer cells. The cancer has a higher metabolic rate, and your hair cells. That's why when the medicine is working, it makes cancer patients lose their hair. And it's not just the hair on their head. They can lose their eyelashes, their eyebrows, all those things. So that's kind of a compromise that you make. It's an indication that the chemotherapy is working in high metabolic cells. And so it lets you know that once you get through it, your hair will grow back. So the weight loss can do it. The thinning can be due to hormonal changes related to having lower fat mass. Fat is very important and significant in female hormone metabolism. So if you have less fat, you have less hormone metabolism and or less hormones. So that can do it as well. And so it is not, it's a compromise you sometimes have to make. You want to be thin, but your hair may be thinner. But once everything stabilizes, your hair, if you don't already have other issues with your hair, then your hair should thicken back up and not fall out. And you should have a full, beautiful head of hair, but also be slim, trim, and sexy. These medications, they are GLP-1 inhibitors. Wegovy is the weight loss brand of Ozempic. Semaglutide, it's the same exact medicine made by the same exact company, but the Ozempic has an indication of treating diabetes and results in weight loss. Wegovy has the indication of you don't have to be diabetic, you just want to lose weight. So, but it's the exact same medication. So that is the thing that you can get with that. So great question, Bunny. And you don't get hair loss with lipo drops. So you can use the entire lipo product line, our lipo nights, our lipo drops maximum strength, and our Keto Max, and that will give you weight loss without putting your hair at risk. Cliff J, what's up, Doc? Rickey Smiley Morning Show, listening for 20 years. Glad you've been listening. I've been on there for at least 15, so we ought to be good friends by now. So the blood pressure medications that don't affect your manhood, I take carvedilol. Is good for me. Carvedilol is good, not great. Wouldn't be my first choice. My first two choices are calcium channel blockers, such as amlodipine, or Norvasc is the brand name. Amlodipine is generic name. Verapamil is now enjoying a renewed enthusiasm, and a drug called Procardia. These are all medications that are vasodilators. They take, for instance, if you consider your blood, your arteries like pipes in your home. You have a pipe this big. That pipe has a certain amount of fluid in it, okay? Now, you take that medicine, it makes the pipe bigger. So you have a bigger pipe, same amount of fluid, ergo less pressure. The benefit of that is the mechanism of erection is one of blood flow. So now you have larger arteries in your penis. That means more blood. So it literally makes your erections longer and harder. Nobody ever complains about that. So this is not a problem. This is a benefit. And one of the great reasons I like to use that class of medication, because not only does it not negatively impact your love life, it actually enhances it. The second category are ACE inhibitors or angiotensin receptor blockers. ACEs are ARBs. These medications are benign for sexual function because they don't affect it one way or the other. What they do is block the effects of a hormone that your kidneys secrete that makes your blood pressure go up under stress. By blocking the effect of that hormone, it does not bring your blood pressure down. What it does effectively is stop your blood pressure from going up. That is a very important and significant difference. Does not bring your blood pressure down actively. It stops your blood pressure from going up. Your blood pressure falls back down to a natural set point, which should be a normal blood pressure. So those medications, either or together. I use that combination very commonly in my difficult to control hypertensive patients. My next drug that I will usually add is carvedilol. It's a beta blocker class drug. It has specific receptors that only go to the heart and controls contractility. So your heart should beat like this. Your heart can do that for 100 years, no problem. Let's give it 120. 120, no problem. When you have high blood pressure, your heart is pumping like this. That is exercise, that is stress, and that takes energy out of the heart. And so, like any muscle that you exercise, you do push-ups, you lift weights, you get big muscles. Well, when your heart is working like that, instead of like this, it gets bigger. The problem is a big heart does not work as effectively or as efficiently as a little heart does. And a little heart doesn't require as much blood flow as a large heart is. A large heart can literally outgrow its own blood supply. Because remember, unlike any other place in your body, the heart only has two arteries. The left, which controls 2/3 of the heart musculature, and the right, which controls 1/3. And that's it. If either of them are compromised, then your heart, or if it can't get blood flow to the distant portions of your heart starts to fail. And that is the problem with that. So those are the things that I recommend for that. Calcium channel blockers, beta blockers, third choice, because carvedilol is a beta blocker, and then ACE inhibitors or angiotensin receptor blockers. Those two combinations. But if you have to add the third choice, carvedilol is probably my third choice 90% of the time. And so, but that's also because you're already on the other two medications. And so that would help. It may take 3 to 5 medications to control a person's blood pressure. So don't be surprised if that is indeed the case. And don't, embrace the desire to control your blood pressure. The compromise is, or the desire is, do I take a medicine or I don't take a medicine? Once you decide to take a medicine, you take a therapeutic dose or one that works for you. I get patients say, well, okay, Dr. Collier, I don't want to take medicine, but I'll take medicine, but give me the lowest dose. And that just makes no clinical sense. The objective is not to take the lowest dose. The objective is to take the dose that works for you. Okay, Holly, final question. Let's get to it. Gail Morris, I'm becoming more and more insulin resistant and a huge diabetic belly. My doctor has no interest in lowering my insulin intake. I feel like I'm overdosed on insulin injections. What am I to do? Help, please. Gail, you are absolutely correct, and you would probably benefit if you are a type 2 diabetic. You could benefit from these GLP-1 injections, amongst other things. But you are the perfect patient to supplement your insulin with lipodrops. Lipodrops Max would be great because you lose the muffin top with lipodrops. It helps target abdominal fat, and the abdominal fat is the one that increases when you have insulin resistance. They call that the metabolic syndrome, and part of that is having, for a woman, a waist size greater than 36, for a man, a waist size greater than 40. So, and we're talking about inches, and you measure at the belly button. You don't go under all that fat and measure at your pubic and say, oh, I still got a 32-inch waist. No, you don't. You wrap that tape measure around your stomach and you measure at your belly button. So with the diagnosis of metabolic syndrome, which you have, then you need to treat each one of those things. Metabolic syndromes mean not only diabetes, but usually high blood pressure and high cholesterol as well. And you cannot control one of those three entities unless you control all of those three entities. But a supplement like the lipodrops and liponites will be great and help decrease abdominal fat and help with you. But if you are more insulin resistant, again, you need to consider two classes of drugs. SGLT2 inhibitors, those would be Farxiga and Jardiance. What they do is make you urinate out sugar, but what happens is you also urinate out the calories associated with that sugar, so it literally makes you lose weight. That instead of or in addition to the GLP-1 injections like Ozempic or Mounjaro. Mounjaro is a better molecule. It works better. It has multiple receptors. They both work, however. So if your insurance company will cover one or the other, then I will get the one that they will cover. Okay, this brings to an end This episode of the Ask Dr. MJ, Your Health is Important, Facebook Live, YouTube Live, Instagram Live broadcast that allows you, the listeners, to call in and ask your healthcare questions. So we are live in the studios every Wednesday at 6:30 p.m. Eastern Standard Time. Tell all your friends, tell your family members, and the information that you have gotten today. Don't just keep it to yourself. Share it with your social group. Share it with your siblings. When you're sitting with your sisters, when you're sitting with your brothers, when you're sitting at a family this weekend, it's going to be family gathering. Don't just play spades. Don't just play dominoes. Talk about healthy issues. Say, I heard Dr. Collier say this, and share that information so you can enhance the health of your family. Remember why? Because your health is important. Thank you. We'll see you next time.